Good morning, everybody. My name's StJohn Crean, and I'm the Vice-Chancellor for Research and Enterprise here at the University of Lancashire. And welcome to our latest episode in our podcast series for the Research and Knowledge Exchange Festival. Now, these podcasts are to showcase some of the excellent and leading latest research that colleagues in the university undertake and some of the associated innovations and practices and policy changes that they influence from across our whole research and knowledge exchange community. The theme we are embracing for the festival and for most of our academic lives, whilst we pursue these subjects, is to transform lives and create prosperity for Lancashire, the United Kingdom and even beyond. But a lot of what we do, of course, is centred around engaging with local collaborators and businesses and local politicians and support many strategies like the Lancashire Growth Plan. Today, I'm absolutely delighted to be joined by a couple of colleagues. First of all, Professor Ihtesham Rehman, who's our Head of Translational Research here at the University and Head of Research for the School of Medicine and Dentistry, and Dr. Heather Cameron-Whytock, who's our Veterinary Principal Lecturer for Education in the growing new School of Veterinary Medicine. We're here to discuss some of the latest work and understanding and developments that have been undertaken in the area of One Health, an up-and-coming area highly recognised now as influential on a number of areas that our population lives in and develops in and grows in. And it fits in with the festival theme of health and well-being. So to you first, Ihtesham, welcome. Thank you very much for giving up your time.
Thank you.
Fairly simple questions to put to you. First of all, describe a little bit about yourself and a little bit about your background, your role here at the university. But I'd be very interested to understand or listen to your concepts around what you think One Health is all about. Ihtesham.
Thanks, StJohn. First of all, thanks for inviting me.
Pleasure.
I'm, as you said, Head of Translational Research for the university, and in my other role, the Head of Research for School of Medicine and Dentistry. That combination is, in fact, is very interesting and very much related to One Health because, it brings different disciplines together, and that's exactly what we are talking today. So, One Health, it is, we are talking about a combination of human health, animal health, and the environment. And they are all linked together. So in my role as a head of translational research, I look at all those aspects from different angles.
Yeah.
And especially when it comes to my own research, then the early detection and diagnosis, that plays a major role in there. Then the other disciplines, which we will discuss later on. But in my background, I'm Professor of Biomaterials and Regenerative Medicine. And that again links very nicely with the discipline which we will be discussing today as a One Health. Because the biomaterials, they are used in animal research, they are used in human research, and they play a major role in environment as well, especially when we are talking about the degradation aspect, which is a major challenge we are facing. And all those combined together, that brings a discipline as a One Health.
Yeah, I think there is so much to talk about there, so much enrichment, and we hope the festival will shine a light on some of those particular areas. But I think, and we'll speak to Heather in a moment, but I think we often get buried into subjects like medicine and veterinary medicine, whereas in fact there are so many other areas that contribute to environmental development, and that brings home this whole concept that health is a personal responsibility, not only for what one sort of looks after one's body or looks after the environment, looks after the environments that we live in, but it's that if we don't, you can have a good diet but live in a bad environment, your risks remain, don't they? I think that the opening up of that subject under One Health is going to be so interesting. Your involvement in One Health in the past, have you been directly involved in One Health projects, or do you feel this is a an emerging area that is getting an increased amount of attention?
One Health is an area which is expanding, and it is an emerging area from the angle that different disciplines are recognizing the importance of each other.
Yeah, that's a key point, isn't it?
It is the key point because, if you look at all the human diseases, the 75% of that, they come through animals, through environments, and they are contributing factor and compounding factor, if I may say. So learning about each of them, how they are linked together, this is really, really crucial. And especially when it comes to, for example, if you need to identify any disease at the early stage and where the source of it, that is really crucial. And we as a university, we got a tremendous strength which we need to flag up more often. There are not many institutions in the UK which will have a School of Medicine and Dentistry, School of Veterinary Sciences, School of Pharmacy, Environmental Sciences. They are all linked together.
Yeah.
And that research which is going on of interdisciplinary, multidisciplinary, and cross-disciplinary, that is really, really crucial.
Yeah.
So coming back to your question of my own experience, yes, I have actually set up a center already in Pakistan, which is an interdisciplinary research center in One Health, which is progressing pretty well in the University of Sargodha. And it's such a coincidence that Vice-Chancellor will be visiting next week to us.
Okay.
Exactly to discuss, One Health, how we can work together. Prior to that, I set up an interdisciplinary research center in biomedical materials, again in Pakistan, which is regarded as one of the largest and one of the best in Asia, specifically focused on human health. So now both of them are working together.
Yeah.
So that is a classic example. And coming to the regional importance, in our region, if we look at, I think we are the only institution having that strength of School of Veterinary Medicine, School of Dentistry, School of Medicine, School of Pharmacy, engineering, and other environmental research which is going on. That all needs to link together.
I agree. It's a rich body of source of information and knowledge and research activity that we have available to us. And of course, in amongst all of that is public health, of course, which is a big issue. Heather, if I can turn to you, you've heard a version, if you like, from the medical world particularly, and I think it's an understanding that this is a triumvirate, if you like, of medicine, animal and environment. Tell us a little bit about yourself, first of all, and then same question about how you feel One Health through the prism of animal health, if you like, or the animal kingdom, and any work that you might be involved with that be related to this area.
Yeah, thank you. So, as you said, I'm in the School of Veterinary Medicine, and I specialise in equine welfare and safety in sport, particularly in a sport called eventing, which I can talk a little bit more about a little bit later.
Only if you've got some good racing tips for us.
Yeah, not so involved in racing. I have done a little bit in there, but yeah, more in eventing. And eventing is a little bit, it might seem quite niche and a little bit like an unknown sport, but actually globally and in Great Britain, it contributes hugely to Olympic success, for example. So it's got a global platform, and in that sense, it's not small at all. So One Health, as we've discussed and as Ihtesham discussed, traditionally focuses on human, animal and environmental health. But from the veterinary perspective, we try to capture also welfare and well-being, which you did mention. And we'll often use the term One Health, One Welfare to ensure that builds on this One Health concept, recognising that welfare is also interconnected, because otherwise it's quite easy for us to focus on health and forget about well-being. And we know from lots of really excellent examples in research that well-being can be explicitly tied to health, and the well-being of animals can be explicitly tied to their human counterparts. We see that, for example, animal abuse and human abuse are interconnected. and that the health and welfare of people is explicitly linked to their pets in which they own and care for. So it highlights that we need to acknowledge as you said, the environment that people and animals are in, and how that impacts the whole picture.
I think the mental health and the well-being element is, I think, increasing focus on that now, isn't there, in the health arena, and the stress that people live under in the modern day, particularly given the geopolitics that we're all witnessing at the moment. It can create an uncertainty, can't it, going forward? And very often animals are that point of contact to bring some security and some resilience and a little bit of consistency into people's lives. The research in the veterinary school, it's going to be reflective of One Health going forward, reaching out to other areas of the university, I assume?
Yeah, and our research strategy is built around the concept of One Health, One Welfare, and that interconnection between those different factors.
Yeah.
And something that we are very keen on advocating for is, animal welfare, environmental sustainability in relevance to the veterinary world, as well as animal and pet ownership, as well as health and the impact that animals can have on that, as you've highlighted.
Universities can be areas of lots of activity, but you two are good examples, because I know how busy you both are. That's the risk. Sometimes it becomes quite siloed in its activity and forgets the other areas where there is crossover of activity. I'm assuming it would do us no harm to consider bringing elements of One Health together under an umbrella of, let's call it research and development to start with. But I'm assuming that's an idea, Ihtesham, that would probably sit well with most of the senior researchers in the university.
Oh, absolutely. The One Health, as I said earlier, it's a combination. And it's a combination of all those disciplines getting together. And from the research angle, as I mentioned, the detection side is really, really crucial.
Yeah.
WHO is highlighting again and again the antimicrobial research, which is having a direct link with the use or misuse of antibiotics, both in
humans and animals.
In humans and animals. And, and especially the reason that we are becoming resistant to current antibiotics available, the food chain which comes from the animals, there is not much control of use of antibiotics on the poultry side, and especially in developing countries. I have seen it in Pakistan, where they just throw antibiotics into the poultry feed, and the other countries in that area as well. So WHO is really trying their best to clamp on it, how we can stop that, because that ends up in the human chain and creates significant problem. Coming back to your point, that, in the university, what we are doing, we're developing different technologies. And as a head of translational research, I'm always looking for which one can be taken from lab towards commercialization and lab towards use in the human, use in the veterinary side. And that will create not only a regional, a national, international impact.
But I'm also, that's fantastic about the direction and strategic guidance that this topic is creating. But I'm assuming it's an opportunity for Heather and colleagues in the veterinary school to start to meet other areas of university or other colleagues in the university who contribute to the research arena. I'm assuming we are moving towards the creation of a vehicle in which, let's say, the three elements of this One Health will come together on a regular basis and share the activity they're doing, and perhaps come together when it comes to supporting local government strategy, national strategy. Is that the idea? Is there a move towards bringing all the disciplines together?
Absolutely, and I just highlight that, in a few examples. We got a few research projects going on with the veterinary school of medicine, and we are also got projects going on in the food security with our colleague Professor Nikki Lowe, and she's looking at on an international projects working in Pakistan.
Good.
And that is also the looking at the effect of the environment, because she's working in those areas which have been devastated by flood,
Yeah.
and that has created a food chain problem
Yeah.
in the area, and that and due to the flood, what diseases have been come. So environment has actually affected the food security, health of animals, and when animals are affected and the crops are affected, human health is automatically affected.
Yeah. It's always going to struggle, isn't it?
So, yeah,
It's always gonna
so
struggle.
we are working together
Yeah.
in the university, which is a classic example
Yeah.
of different disciplines getting
Yeah.
together.
I think, Heather, the development of the veterinary medicine school and the skills that brings, that adds a whole new rich flavour to the portfolio here. Is One Health a subject area in veterinary academic world that is emerging, is getting stronger, or is there a feeling that at last people are listening to us?
Yeah, it's definitely growing 100%. And for example, we've got a postgraduate course in Global One Health on welfare.
Okay,
So we are recruiting into that.
that's really
academically.
good. That's what sort of applicants do you get for that? Or
Professionals from, for example, they might be from a veterinary clinical background.
Yes.
They might be from a predominantly research background.
yes,
But it's people that want to expand on skills they've already got in
Yes.
line with current, activity around the world.
yeah, fabulous.
And as Ihtesham said, we've been growing our activity in this area and working on collaborating. We've been meeting quite regularly to discuss growing the One
That's
Health space, and we've also just started the Unit of Assessment 6 work for REF, which is food, agriculture and veterinary, so it's perfectly One Health.
Yeah, I'm looking forward to that.
Yeah.
Making some great strides. Well, listen, both of you, we could talk for a long time about, let's face it, an enormous subject, but the festival itself will highlight more granular details of what we're doing and what we're planning for the future. And I'd just like to thank you both for your time today. And now we've heard from Ihtesham and from Heather, and I'd like to thank colleagues who are joining us today at the festival. I hope that the conversation that Ihtesham and Heather have provided will give you some stimulation and some background to what type of problems exist that One Health may be able to address or even identify from a diagnostic perspective. You're going to hear more about the One Health team as well later today in the Harris Museum, because there's an event there which will highlight some of the developments and projects for the future. And of course, I'd like to remind everybody listening to the podcast that you can find out everything that's going on throughout the festival week on the festival website, on the university website. To both of you, thank you for your time, and I look forward to seeing you in the festival. Thank you.
Thank you.
Thank you.
Thank you.